Hi, my name is Damaris Ndua. I'm the fellowship program lead at Mawazo Institute. Mawazo Institute has two programs, and one of the programs is the fellowship program. This is the entry point of of the women that we support yeah, in the institution. So we provide support to our fellows who are African women pursuing their PhD in Africa, and we provide them support through trainings. We provide them through financial support, wellness and well-being, and as well as mentorship. I want to talk a little bit about our financial support, more specifically the fellowship flexible funds that we provide our African women researchers. So this was introduced for this cohort, which is the 2025 to 2026 cohort. Reason being is that in the past we were providing women with the Fellows Fund, which was more specific to to supporting them to complete their PhD or supporting them to research activities towards the completion of their PhD. But we realized, based on the conversation that you're having with these women, that this was not enough. That beyond just to complete their PhD, the financial support for their research activities wasn't enough because these women were struggling with taking care of their families. They were struggling with mental health. They were struggling with work-life balance and also taking care of themselves. So based on the feedback that we got from the women and wanting to support them, fully, we introduced the flexible funds. This is the first time that Mawazo Institute is doing this and is providing this support to these women. So how does this? What type of support does the flexible fund, provide? It provides support under various components. So one is, emergency. So ideally, what happens is you've planned your finances in a certain way, and then something happens, an emergency happens. For example, you lose your loved one, or you have, you're robbed, or you have, flooding that has destroyed your property. So just to support our women with that, just that a bit of relief, especially the financial aspect, we come in and we provide them with funds, just to be able to, to have a little bit of kitty to buy, some new items if they have destroyed, the person that items destroyed through a flooding, or maybe to, bury a loved ones. So even if this will not elevate the emotional, struggles or the pain that they'll be going through, at least it will provide some level of comfort that this is something else they don't have to worry about. Under the flexible funds, we also support them with wellness and well-being. And to be more specifically, we tell these women what wellness and well-being is to them. So what does that mean? We have women who are really going through a lot, and some of them require, counseling services. So they can be able to seek, counselors and psychologists for this. For some, they just want a little bit of time to unwind or to take care of their physical well-being and mental well-being in the gym. For others, it's swimming, that is their preference. So we're able to provide the support for them in that way. For others, they just need some time away, maybe to just focus on the research, just to get that, mental relief. So under the wellness component, this is also catered for. So just to expound on that, you want a day to just go and work on your research paper, and maybe you want to do this in a hotel. We're able to cater this to cater this for you. Yeah, and then other ways that you've been able to support and elevate that mental struggle or mental exhaustion or even emotional turmoil that comes even with being a woman in Africa pursuing your PhD is through the flexible fund under the physical or support or health support. So what does that mean? Maybe we have women who are struggling to maybe they're getting glasses with your dental hygiene or dental they need to get the teeth checked. They also need they require medication for their hypertension, diabetes, etc., etc. And we've heard from these women that giving them this financial elevation really helps them because, for example, if a woman is stressing about not being able to pay for the medication, for their blood pressure, and we really want them to focus, on their studies, it's really hard for them to do so. So providing that elevation, really, really